So how does this technically save the district any money?
So that's what I'm hoping
There were lots of questions, but also lots of answers at a Pewaukee forum on the Senate Democrats' plan to address Wisconsin's health care cost crisis. The forum, sponsored by Cedar Lake United Educators, drew about 250 educators, school board members, business people, and others. It focused on the Senate Democrats' Healthy Wisconsin plan. State Senator John Erpenbach was joined by Robert Craig of Citizen Action of Wisconsin to present and explain details of the plan. The plan was well received, but as you would expect from a room full of educators, questions were many.
I will be retiring in a couple of years. How can I use Healthy Wisconsin as a secondary insurance?
So this plan covers everybody, even if they're not working?
Do you see a negative or a positive impact on the business climate?
What's the likelihood of Republicans getting control of the Assembly and the Senate in the future?
Can you tell us what that technical correction is?
I want you to say my last name because I tend to vote Republican, so I'll never get out of the parking lot.
So like you're the witness protection
in the
program.
beginning, but I guess I would like to know who actually is running the Healthy Wisconsin program.
Who runs it? There's a guy named Louis. I'm kidding. There's a board of trustees, and the board of trustees will be basically appointed by the state senate, nominated by the governor, confirmed by the state senate. Basically what it is, it's universal coverage. It's the same kind of health care choices that I have, that Governor Doyle has.
It guarantees quality, affordable health care. It guarantees control and choice. You can choose between high-quality private plans or public plans, and your medical care is between you and your doctor and your family, not insurance company bureaucrats anymore, and certainly not government bureaucrats.
Let me tell you why we have Healthy Wisconsin before us. The Senate Democrats picked up the majority in the last election cycle. We picked up 4 seats, and we hadn't been in the majority for a while at the Capitol. And there were 4 issues within those 4 seats, but one of them was consistent from one end of the state to the other. It was healthcare reform, affordable healthcare. And so my job as the chair of the health committee was to take 4 or 5 plans that were floating out there and tie them all together and then add to it and come up with something that we think people would like. But it had to be affordable, and it had to be the same kind of health care choices that I as a state senator have, or that any state employee would have. I'm gonna dispel some rumors that are out there. Healthy Wisconsin is not a Canadian government-run healthcare system. It's not. Healthy Wisconsin is your choice. It's your plan. It's whatever doctor you want to see. But under Healthy Wisconsin, you have to have a doctor. The average person in the state, the average household income in Wisconsin is about $43,000 a year. $43,000 a year for your average household income. It's going to cost that house about $140 a month. Within Healthy Wisconsin, there's a copay for me to go see the doctor. But there's not a copay, as Robert said, for anything preventative. Physicals, mammograms, things we need to get into the doctor to get checked on once a year or once every 6 months or whatever. There are no copays at all. If you have a chronic disease, Healthy Wisconsin won't cost you anything for your drugs. They're free. We want you, if you have a chronic disease, to stay in your medication. We want you to get in to see the doctor as often as you're supposed to, so the best way to do that is to make it free. No copays for any of that. Stick to your plan. You would think we're giving away the store here, but we're actually saving money, because the disease is going to be managed properly. When it's managed properly, it costs all of us less.
That teachers know that they can't really get real wage increases in the future if healthcare costs double again. And in addition, they also worry about their students, the families in their school districts, and they want to do the right thing by them as well. And so I think teachers and educators in general, I should say educators, are an extremely important moral force and voice in this whole process. And if we're going to get this done, we need the voice of educators, and we see it here in this room today, and we see it in the support WEAC has given to real health care reform.
So over the past 15 years, you've given up wage increases to hang on to the benefits that you have. We are not going to punish you when a new health care reform plan comes out. We're not going to. So Even under Healthy Wisconsin, even the way it's written right now, school districts will save a tremendous amount of money. Every business in this country is having the same problem when it comes to healthcare costs. If we have an affordable, fixed cost when it comes to healthcare, and we take the burden off of their shoulders, and they don't have to worry about affording it anymore, they just have to buy into it at a lower cost than what they're paying for now, they're providing benefits. You couple that, and I'm very sincere when I say this, with the best schools in the nation, businesses are going to come here. We do know if we do nothing, what the teachers have for benefits right now, coupled with the QEO, man, it's gonna be an Armageddon at some point in time unless we do something.
It was a milestone that Healthy Wisconsin passed the Senate. We now need to get a very strong mandate and then get ready for a huge fight, because it'll be a Donnybrook to get this through.
Whether you agree or disagree with Healthy Wisconsin, I'm assuming you think something needs to be done. Ask those running for office what they want to do about health care. Ask them specifically what they want to do about the high cost of health care. Thanks for having us out tonight. We appreciate it. Thank you.